Assalamu alaikum. My name is Humaira Shaheen. I'm a clinical psychologist. Today I will talk about the psychological impact of breast cancer. Breast cancer is considered major public health problem for women. 180,000 women in United States are diagnosed with breast cancer and more than 40,000 die from this disease. In Pakistan, one among 9 women can have a chance to develop this disease. Breast cancer is basically a disease that had a very poor prognosis and was treated with aggressive form of surgery, and this surgery can have a very negative side effects. But nowadays there are so many advancements. For example, early detection can be possible, different diagnostic methods, surgical and medical treatments are now available. All these advancements can improve the quality of life of the patient, but despite of all these, still it remains very painful for the patient. Many researchers have done, and the researchers interviewed the patient at different stages and different severity level, and they concluded that in early phases negative emotions and psychological distress in form of anxiety and depression is very common. Then there is possibility of post stress traumatic disorder, and its prevalence is 30 to 40% is high as compared to the normal population. Then after getting surgery or the treatment, there is a possibility of psychological problem regarding the body image and sexual functioning. Another research concluded that there is high level of psychological distress in early 3 months. And then there is a finding of a research in which they conclude that the depression is very common after the treatment, and it may prolong for a year or for many years. Whenever there is abnormal situation, for example, any patient who suddenly comes to know about the diagnosis of breast cancer, she may react with shock, anger, irritability, or denial, that she may simply denies there is not a problem, and she is not suffering such kind of problem, or she may not accept this. And there is in the form of sadness, and it can be in the form of acceptance, or there is some women who simply जो है वो accept करती हैं and that there is a problem of breast cancer and she has to struggle with it. Then there is some healthy emotional response that can be in 3 phases, and this healthy emotional response actually varies for patient to patient. For some patient it can be of few weeks, few months, or for some patient it can be of years. What happens in it is actually of 3 phases. First of all, there is initial reaction that can be in form of shock or disbelief, or then there is distress that can be in form of anxiety, anger, low mood, and there is adjustment in which patient learns how to survive with this disease. Then there is some predictors of adjustment. Predictors are some factors whose absence or presence can affect the disease distress or its adjustment. First of all, characteristics of disease, its severity level, like either it is mild, moderate, or severe. Then characteristics of patient in form of age, education, or demographic data. It has been observed that distress level is very high in young age patient as compared to the olders. Then there is also finding that the patients who are highly educated, they have a low distress level. And demographic data, it means that if the patient have a medical facility that is approachable, so definitely it minimize her distress level. Then there is social relationship and interpersonal resources. The patient who is socially interactive can minimize or can manage their distress. Then a cognitive appraisal and attribution, in a sense, then that the perception of disease and its causes for patient. that how they perceive the disease, or if she thinks that she can have a control over the course of disease, or she can manage with this disease. So this all kind of perception can affect their distress, and it can be she can manage with this kind of positive perception or thinking. Then there is other coping methods, for example venting and other physical exercises. If patient is in practice of these coping methods, then she can minimize their distress. Quality of social support, and social support in a sense that if patient thinks that she is surrounded by the patients or by the persons who can provide them the support, so it's mean that she has social support. And among social support, emotional support shows most consistent relationship to lower the distress and higher quality of the life. Then optimistic beliefs about future outcomes. For example, if patient thinks that there will be a positive outcomes, and this kind of perceptions or this kind of belief about their outcome can help to minimize the distress. And next to it is self blame. If she thinks that she herself is responsible for the disorder or for the disease, so it can increase the distress. Then psychological intervention, relaxation and guided imagery techniques can be used. By providing the education about the disease, we can help the patient. Then by providing the opportunity to express the emotion, this can be done individually or can be done in group basis. Then to encourage the patient to exchange the social support with other patients who are having same kind of diagnosis. And another cognitive behavioral coping skills can be used. By improving the relationship with families, doctors, we can help them. And by helping them to express the emotions, and by helping them to get their problem solved. For example, if they are having some problem regarding their treatment issues or regarding their disease related in any queries, so we can help them. And we can guide them to search the information, and can ask the doctors, or they can have a different opinions to get their satisfaction. So by providing these all techniques, we can help the patients, and we can foster their hope through the technique of spikes, in which we help the patient to sit in a comfortable environment, and we ask what actually she knows about the disease and what else she wants to know about the disease. Then by providing the information and managing her responses or feelings, we can help the patients and we can foster their hope. So these are some techniques that can be used in clinical setting. And these here it is are some references that you can use for your own interest to study further in this regard. Thank you, Ji. Thank you so much.